Look at this eye here. You see that mass here, that dark color there? That is the thyroid. You can see you have chronic thyroid, okay? It's very clear. This spot right here, that's a parathyroid. You see that dark spot here? That results with tissue integrity. When you have bone issues, skin issues like skin quality, like wrinkles, hernias, varicose veins, spider veins, weak parathyroid. And your tonsils here are congested as well, okay, full of mucus as well. This is the main lymph node of the head region. That's what drains acids out, and so that's why you can have tension or pain in the neck region. Anything in the head region, congestion is due to the tonsils not draining out or converting acids to lesser acids properly. Okay, it needs to be cleaned out. Use the endocrine tincture. Right here, you can see. Okay, this is the lower back, and here's a bladder. You can see it's all congested of mucus and acids, and right here is where the prostate would be. Okay, the prostate right here, and the penis region right here. And this line here, right here, is the kidneys and adrenals. You can see also chronic, okay, which will explain why you have lymph stagnation. That white cloud-like structure in the eye, that's lymph stagnation. And you have a lot of candida. That yellow color you see here, the yellow, orange color, that's candida sulfur. Okay, and that's fungal overgrowth will occur. So you can see clearly that yellow tintish color is fungus. And it's especially heavy in the brain area. Okay, very prominent. And right here with the right foot, knee, and thigh, which you can see is congested with mucus as well. Okay, you can see clearly because it's covered, but you can see how it's dark. Okay, the chest, ribs, and thorax region, you can see full of mucus congestion. You see those dark spots right here. So I will use a respiratory T and a respiratory 1 tincture. Right here is the lower and upper lung region. You can see also heavy with mucus or lymph stagnation. The dark congestion right here. So you need to clean your lungs out. Use the respiratory T and respiratory 1 tincture. Your bowels are very chronic. All this is the bowels. Here's ascending colon, here's a transverse colon, here's a descending colon. You can see full of mucus. I would use a bowel cleanser and a bowel strength tincture to clean it. That dark line going around the pupil, that's a malabsorption ring, means you're malabsorbed. You're not absorbing nutrients as you should be due to mucus plaque in the small intestine. This needs to be cleaned out, okay? There's a potential cataract issues arising. There's cholesterol in the pupil, shows potential cataracts. And there's a slight cholesterol ring around the iris, indicates high acidosis. Your body is using cholesterol to fight, bind to acids. The cholesterol we speak of here is the cholesterol is used as an acid used to defend itself against metabolic waste or acids to neutralize it. And in the left eye here, you can see heavy stagnation in the heart. Right here is the heart. See how dark it is? Okay. Right here is the lower and upper lung region, also full of mucus, just like the other eye. So you need to address the lung region, you need to address the heart. Use circulation herbs to help boost blood flow. You can see the fungal overgrowth in the whole body, okay? See the yellow-orange color? That's fungus and candida, potential sulfur deposits from medication, from the food you've been eating. And right here is the upper back region. You can see congested with mucus as well, okay? A lot of mucus congestion. And right here is the thyroid, again. Shows weak thyroid again. You need to address this. So I'll use a thyroid lift tincture. This eye is quite congested of lymph. When you see that white structure, cloud-like structure, that's lymph stagnation. It means your kidneys are not filtering out waste properly. It means your adrenals are weak. Okay. If you look closely, you see some white dots going around the iris. Those are lymph nodes. They are stagnant. Okay. They're moving to the swollen side. You need to address this as well. And your sclera, the white here, shows high acidosis. A lot of red blood vessels. So all this needs to be cleaned up. Okay. You also have the malabsorption ring around here as well, very obvious. And the bowels are quite chronic. Ascending colon, transverse colon, descending colon are chronic bowels. This needs to be cleaned up. I'll be on 100% fruit diet and using all the herbs I suggested.